Doctors have read it. What's something you've had to tell a patient that you thought for sure was common knowledge? Story 1. In a free medical clinic, I had to tell a mother that she should be brushing her 4-year-old's teeth. The daughter came in because her throat hurt. After opening her mouth and using a tongue depressor to see her throat, the daughter squirmed like 4-year-olds are prone to do, and the tongue depressor hit her gums. It made a mess, and the child wound up to be having put on penicillin before having every last tooth pulled due to infection. You should start brushing your infant's teeth as soon as they start teething and do a gentle gum massage with a baby toothbrush before that. Use safe-to-swallow toothpaste before the child is 10. Let the child brush their own teeth as soon as they're able, for practice. And then have an adult brush them at a 45-degree angle towards the gums in small circles. Children should be supervised by brushing their teeth until they're at least 12 or longer if necessary. This occurred in Nicaragua, quite far from any major city, and wasn't reported because the mother did follow-up and kept the appointment for extractions. The thought of brushing her daughter's teeth simply never arose. Before modern toothbrushes were invented, people used bones, porcupine quills, sticks, and chew sticks. The ancient Romans had toothbrushes as well. Yes, you should brush your pet's teeth. Pet toothpaste only, no fluoride. No, I didn't go hard on the mother. She was provided with 6 months' worth of dental supplies for both of them and thoroughly educated on dental hygiene. Was the mom expecting the baby to do it on their own? Poor kid. That sounds like a bad time. Story 2. My little cousin had dentures at 3 or 4 because all his teeth rotted out, not even being raised by some young dumb mom. He's with his 50-something grandmother. Pretty sure he got orange juice and Kool-Aid at the same time he got off formula, and this was before they had an accident with a lawnmower and had to get most of his foot surgically removed. Poor guy. Some people shouldn't have kids or grandkids. They are lazy and dumb people, not malicious. It's my relation. If I truly thought anyone was being I'd be the first to report it. Most of the problems in that house stem from neglect. It's not bad enough to be considered apparently. Child services have been there multiple times, both with their grandkids and their kids before that. They're a military family, with a disabled child, and she had many years of experience manipulating the system. I don't understand if she kept her kids or these grandkids either. I'd take them in myself if it was at all possible. Story 3. I once had a patient with a cancer diagnosis completely depressed about not being able to see their family anymore. I was confused, because I had spoken with the individual's spouse and extended family who seemed supportive. There wasn't any indication of family problems, etc. It turns out that this individual thought genetic and family history had meant something similar to contagious, leading them to the conclusion that one should stay away from loved ones lest it spread through the family. That was one clarification I was so happy to give. To those wondering how such a misunderstanding is possible, keep in mind that we ought not to judge. Not everyone has the benefit of a good education, nor is everyone part of a generation and culture that has always had medicine and science in their lives. Other times, language and jargon can be a barrier to understanding. I was not the physician that failed to communicate the issues effectively, but we were all glad that at least this problem could easily be dealt with. Story 4. I used to work for a small-town internal medicine and pediatrics office as a receptionist, and we closed for lunch for 2 hours, which in actuality was for 2 doctors to get to the hospital and check on their patients, or rounds. One day one of the doctors didn't have any patients to check on, so he took a medicine rep up on his offer for lunch and invited him in. I was working on a reorganization project for the files and decided to work through my lunch, so we were the only ones there. A guy came to the door that wasn't anyone I recognized and knocked and asked me to let him in. I said, "Sorry, we open again at 1:30. He started crying. I ran to the door and asked what was wrong. He said, "I don't know," and pointed at the car. A woman was crying and hunched over in the front seat. I told him to keep her calm and ran back inside to grab my doctor. He grabbed a wheelchair and ran out to get her. The medicine rep asked if I knew where the nurses kept supplies, and I got the key to their cabinet. When the doctor came in, he was visibly upset but asked me to get her minor surgery bed ready immediately and asked for the nurse's key. Our med rep said, "I'm in. What do you need, doctor? I'm a current licensed RN." He said some stuff and had me assist with getting the lady on the table. The med rep started IV and had me hold the saline bag while he gave a dose of painkillers. Once he finished, my doctor told me to help undress the woman and asked her if she wanted the man in the room. She said yes, and I undressed her bottom half. As I did, I noticed her jeans were wet. My doctor noticed me and the liquid at the same time and said, "Use gloves." As I pulled off her jeans, we could tell there was a lot of blood. The doctor grabbed the saline bag and asked the med rep to call an ambulance. As I finished pulling off her jeans, I noticed a protrusion from her underwear. The doctor noticed at the same time and said, "You talk to dispatch," and called for the rep. I explained the situation. She freaked, her husband started crying, and the doctor said, "Possible spontaneous birth, likely spontaneous." I told them and started to hear the sirens. The rep met them at the door to explain, and it turned out she had her tubes tied 10 years prior in Mexico that didn't take. It turned out he was stillborn at 28 weeks. She had no idea she was pregnant and had 4 kids already. They were devastated. She was already mostly there. The protrusion I saw was the head, so they had her delivery in our office before taking her to the hospital. As our staff came back from lunch, I met them outside to explain why an ambulance and fire truck were there, and that they could go home because we were closed for the day. They called their afternoon patients and rescheduled. The other doctors made house calls to anyone that he or they felt couldn't wait. It was awful, but it happens. And I hate it when people think that people are just so stupid for not knowing. Psst, guess what? This video is sponsored by none other than me and my awesome crew at Rufus Rugs. We're the masters of creating custom, hand-tufted rugs that truly capture who you are. Whether you're looking to turn one of our intriguing thumbnails into a rug, for purely academic reasons, of course, or you're eager to transform your room with some epic anime-inspired designs, we can get it done for you. These are all handmade by me and the team from Canada. No dropshipping BS here. Real, handmade custom rugs by me and my friends. Click the first link in the description to learn more. Story 5. Not a doctor, but my ex-girlfriend had a severe peanut allergy, and one time she ate a Thai chicken pizza in the college cafeteria that did not list peanuts as one of the ingredients. After her throat started burning, she knew something was wrong, so she grabbed a glass of milk, which I guess helped a bit, and went outside for some air because she was having trouble breathing. A female security guard was passing outside in front of the building and saw that she might need some help. At this point, my ex was looking through her bag for her EpiPen. The security guard asked what was wrong, and she tried to explain that she had a severe peanut allergy and needed to be taken to the hospital. When the security guard saw her take out the EpiPen, she took it from her and said that it was school policy that she be the one to do it. She then asked my ex to hold out her arm so she could inject her. My girlfriend could not believe that the security guard was trying to inject her arm like it was a flu shot, and out of frustration, she yanked it from the guard's hand and put it on her thigh, like you're supposed to, and sternly told her, "I need to get to a hospital now." We had another encounter with the same security guard at one of the townhouses that were part of campus housing. My girlfriend and I were hanging out with our friend Andy, watching TV. He just finished packing a bowl. When the door opened, we saw one of his roommates and a friend of his walking in. We thought nothing of it, but then right behind him was the security guard. His roommate was diabetic and his blood sugar had gone really low, so the guys he was hanging out with called security. He looked very weak and was barely able to stand, but as soon as that security guard saw Andy holding the bowl, she turned her focus to him. She confiscated the bowl and the jar of grass he had out and then asked us all for our school IDs so she could write us up. We had to talk to the dean about it later on, but Andy was cool enough to say that only he was going to smoke and that we just happened to be there. It wasn't until after she got all our information that she turned her attention back to his roommate. She was drinking some juice that his friend gave him. She opened the freezer to look for some quick food to make and found a frozen pizza, opened it, and then shoved it in the oven. "It'll be ready in 10 minutes. Make sure he eats it and call us if he doesn't get better," she said right before leaving. Everything was quiet for a few seconds until Andy said, "That stupid freak didn't even preheat the oven." We all started laughing at the situation. It's so important to keep people from feeling good that I'm going to focus on that instead of the person who's feeling really bad. You just know she went home that night and said, "Dear Diary, today made the world a better place." Story 6. My buddy in high school had an allergic reaction due to a peanut butter sandwich his girlfriend had eaten during lunch. One kiss later, he had an allergic reaction in the middle of his English class. Right before I handed him his EpiPen, I knew where it was and was trained how to administer it. The teacher snatched it out of my hands and began lecturing about how she needed to give it because it was her responsibility because he was in her class. Needless to say, things got interesting after she tried to stick him in the shoulder like giving a shot, when I repeatedly told her the thigh. Long story short, he ended up smacking her in the face, grabbing the pen and administering it himself. The teacher made a huge deal about it, but ended up getting fired for endangering a student's life and refusing to allow 2 trained people to administer the injection. Story 7. So this happened when I was a family doctor. I got a call in the middle of the night, I was on call, from a very distressed new mother. She said her newborn was projectile vomiting with every feed. Projectile vomiting can be a worrisome finding in a newborn, so I asked her to meet me in the ER right away. When I saw the baby, he was smiling, happy, and in perfect good health. The mom assured me that he vomited with every feed, so I asked her to feed him to let me see what happened. She did, and as soon as she finished, the baby started to fuss and then spit up the milk. I asked if this was what she had been seeing. It was. So I asked her if she ever burped the baby. She looked at me puzzled. She had no clue about burping. She said that she thought it was some TV thing. I assured her it was a real thing and at 2 a.m. taught her how to burp a baby. I asked her to follow up with me in a day or two. She came in and said, "You are the best doctor ever. That burping thing you taught me is like magic. Now my baby's happy all the time." So, there you go. Someone who did not know about burping a baby. Story 8. How a shorter or fatter 5 ml oral syringe held more volume than a skinnier and longer 1 ml oral syringe. How does this hold more liquid when it's shorter? Also, I've seen almost every incorrect way to use an inhaler, upside down being fairly common. People taking birth control pills only on the days they do the deed. I no longer assume anything is common knowledge. I'd rather someone be offended that I explained something basic than have something awful happen because I assumed the patient knew something. Isn't this a key part of developmental psychology? Like knowing that different shapes of objects can have greater or less volumes? Isn't it also a good time to leave a like in the video and subscribe to the channel? Story 9. Not a patient, but some people don't handle stress well. I volunteer as an emergency first responder, but one of the funniest cases I've seen of this was out of uniform in an airport. A larger gentleman who suffered from COPD had taken a 6-hour flight. Upon getting through security, he had collapsed and was having difficulty breathing. The first person on the scene to help the guy was a firefighter. I was second on the scene, younger and smaller than the firefighter. I'm 6'3" and not skinny. This guy was just huge. So I'm letting him take the lead as I run through making sure EMS is on the way, checking the guy's vitals, stabilizing his head and neck. Big guy. Went from conscious to unconscious quickly and fell straight down, and getting a history from his family. In the meantime, the firefighter's kinda starting to panic a little. It may have been new or just the fact that he was out of uniform and not expecting it through him. Either way, as the man regains consciousness and I start running through a quick GCS test, which involves me and the gentleman talking to each other, and treating for shock, the firefighter tries to retake the guy's vitals. He fails to find a pulse. Understand that at this point I'm communicating with a patient. He's not completely lucid, but he is speaking to me and groaning. Having failed to find a pulse, the firefighter assumes this gentleman is in full cardiac arrest and begins to attempt to apply an AED to his chest. I say attempt because, along with being large, this gentleman was somewhat hairy. Now, in any first aid course, for anyone, that involves teaching one to use an AED, one of the things you cover is that the razor in the kit is there in case you need to shave someone. The firefighter, having failed to realize that talking probably means the patient isn't in cardiac arrest, and that he's having trouble getting a pulse because the patient is larger, then fails to shave the guy's chest. This leaves the patient with the 2 contact pads hanging off his chest hair, but very much not in any way contacting his skin, while I've just started to realize what the firefighter was trying to do. At that point, fortunately, an older woman arrives and identifies herself as a trauma nurse, who are, by the way, just about the best people to have on your side if something like this happens. She tells him to go talk to the family, takes the lead, and everything goes smoothly from then until the airport medical folks show up and take over. Unfortunately, I'm having trouble not laughing the whole time at the image of the firefighter staring intently at an AED that can't possibly give him a reading on the condition of the now conscious and lucid patient. Story 10. A nursing home called 911 for a patient who was having difficulty breathing. When we arrived, a PA was standing in front of the patient, vigorously fanning the old lady with her hands. She looked at us and said, "I'm giving her some oxygen because we couldn't find a portable O2 tank," and kept flapping her arms. Remember, this is a physician's assistant, probably making $100,000 a year. I informed her that she could stop now, and my partner and I did our best to wait until we were outside to burst out laughing. Story 11. Vet here. I had this lady bring in her female cat who turned out to be pregnant. She was adamant that it was impossible as this was strictly an indoor cat. Upon further questioning, she admitted that there was an intact Tom also living in the same house, but that he couldn't possibly have done it because he was the female cat's brother. Yeah, cats don't work that way. I can just imagine that this woman never looked at her cats the same way again. "You're disgusting, Mr. Buttons. Don't stare at Miss Kitty like that. She's your sister." Story 12. Not a doctor, but a nutritionist. I work with a lot of different patients, and I have tons of stories about food stupidity. Had a lady have bariatric surgery. Your stomach gets surgically stapled smaller, and her mother kept trying to force her to eat real food the day of the surgery when she was on a liquid diet. She would eat it, puke, rip her stitches out, repeat. We had to ban the mother from seeing her because she would literally blackmail and guilt trip this poor lady into eating a whole pizza, barf it all up because her poor post-surgery stomach couldn't handle it, and end up ripping out stitches and cause enormous pain because her mother was positive that she would die if she was on a liquid diet for a couple days. Another lady I was seeing for clinicals was diabetic, and she would come in every week with stupid high blood sugar levels, 250 to 560-ish, not knowing why they were so high. She kept a record of everything she ate, and all her food intake seemed fine. One day, her husband came with her, which was weird, and he ninja slipped me a note while shaking my hand. It read, "Ask her about the Quick Trip slushies. She doesn't believe me that they have sugar in them." So I asked her if she was having any soda, lemonade, tea, ice cream, shakes, or slushies, and she told me like a light bulb had gone off in her head. "Well, I have been drinking about 3 of the 48-ounce Quick Trip slushies every day for a while now. They're just so good. And they aren't food or drink, they're slushies. So they don't have any sugar in them, and I don't need to record them." It was so hard to convince her that those are so full of sugar that it isn't even funny. But seriously, 3 a day on a type 2 diabetic? It was one of the stupidest things I've ever heard in my life. Story 13. So my dad is a trauma anesthesiologist. My childhood was often colored by grisly stories. He worked in a trauma hospital in a city known for its crime. Not Detroit, but he kept busy. His favorite story, though, aside from giving anesthesia to a cow, is that a man once came in with big chunks of metal from a freak accident. The dude was lucky. He lived. Apparently, he'd been operating some dangerous machinery and it had blown up on him. However, when they pulled the chunks out, on a few pieces they could make out factory-printed words. "Always wear eye protection." If only the dude had his safety goggles on, you'd think nothing would be entering his head near the eyes. Story 14. I remember watching a documentary once and there was this lady who had diabetes and her foot was necrotic. The doctor told her she was going to have it amputated, and she said, "No, Jesus will heal it for me," or something like that. The doctor looked at her and said, "Ma'am, your foot is already messed up. Jesus wants you to get it amputated." Did Jesus end up healing it or what? Story 15. Here's my time to shine. So it's the intern year of my surgery residency, and I was sent down to the ED to see a patient that may have a hernia. I went down to see the guy and he looked like a John Denver lookalike with obvious psycho and social deficits who was sitting comfortably. I began my usual line of questioning, and the guy lives by himself, has a girlfriend, and he has had this pain in his groin for a few months now. So I begin a physical exam, and when I get to his inguinal region, there is obvious swelling with something hard in the canal. I then do a testicular exam, and I feel that the guy has only one ball. Very rarely, people with inguinal hernias have their balls retract in their inguinal canal. It can be dangerous if the blood supply is compromised. So I ask the guy how long he has had just one ball. He looks at me like I'm crazy and says, "What do you mean? It's always been like this." I'm confused and try to rephrase the question, but the answer is the same. I am so confused at this point and explain to him that he should have 2 testicles and he has only 1. He begins to argue with me and claims that people have different amounts of nuts, and he was one of the ones with 1. At this point, he starts to develop an attitude, so I skip over it and schedule him for emergent surgery and speak to my attending. I'm the one who gets to scrub into the surgery, and I go to the pre-op area to meet my attending, and he's there talking to Uniball. Uniball and his girlfriend start pointing at me and getting heated with my attending. I approach them and ask what's going on. They start shouting that I tried to trick them into thinking there was something wrong with the dude's testicles, and that I caused unnecessary worry. The attending and I had to explain to the dude and his girlfriend that the overwhelming majority of people have 2 testicles, and it was abnormal to have just 1. They refused to believe us, so we end up taking him to the OR and pulling the hidden testicle out. And long story short, it was a testicle diamond. It was rock hard and super compact. It looked like a super dense hard oyster, just so you know. The chosen one. One of the ones with 1. Coming to theaters near you. I hope you enjoyed the video, and if you made it this far, I'm sure you'll also enjoy Doctors, who were your dumbest patients? Story 2 was so unreal. See you in that video.